And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a bunch of different plastic surgery procedures. We're going to be posting his phone number coming up and telling you how you can email questions to the doctor, all that coming up. But first, we are going to talk about gynecomastia. Yes. What is gynecomastia, Dr. Mealy, and who needs it?
So gyneco is a prefix meaning female.
Oh.
But it's a problem that affects men. And we don't really want female breasts on our chest.
I hear you.
So it's enlargement of the breast.
Okay.
And there's really two types. Formal or real gynecomastia is enlargement of the breast tissue.
Okay.
Whereas pseudogynecomastia, which means fake gynecomastia, is really just a fatty breast. And usually it's somewhere in the middle.
Oh, okay.
So usually there's some fat with a glandular component.
What does it take to get a man into a plastic surgeon's office and say, I need help? That's pretty tough.
Well, it can be embarrassing.
Yeah.
As the breasts enlarge, it not only is it hard to go without a shirt, but sometimes even in a shirt, it's still protuberant and sticking out, and it becomes
painful,
embarrassing.
right?
It can also be very sore.
If you're a runner,
at the
maybe,
pubescent age, when it's first growing,
right.
It can be painful and sore and swelling, and may go up and down, up and down. But if you've just gotten it, if you're a 13-year-old boy and you've just gotten it, it's worth giving it a few years to see if it'll go away.
So just
wait. Often in 2 or 3 years, about half the time, it'll go away on its own.
All right, first picture, what do we have?
So this is a guy with a combination of gynecomastia, pseudogynecomastia. His right side was larger than the left.
Yep.
It's kind of, a uniform breast. It's not just under the nipple. It's not what we call a puffy nipple.
Yeah.
So in this case, I've done some liposuction to remove the extra fat.
Okay.
And then made a little incision right along from about 4 to 8 o'clock along the bottom to get in there and get that firmer tissue out, because the hard stuff won't leave with lipo. It just kind of bounces off.
Really?
So you have to go
so
in
you
there
had
and
to take the fat
remove
pad
it.
out. I gotcha.
Yes.
All right, so.
And the nipples kind of go along for the ride, so they get a little bit smaller. The areola is reduced in size. The position really doesn't change with what I'm doing. They're elevated only because there's not that weight there.
All right, next picture.
So similar here. So this is someone, again, with just extra tissue, again, sort of diffusely enlarged. The areola was bothering him too. We had talked about doing some sort of formal reduction of the areola before.
Right.
But with the amount of tissue behind there, we elected to wait.
Oh, okay.
And it ended up being okay. So by reducing that tissue behind there, the areola shrunk enough where it wasn't bothering him.
Looks really good. And I cannot see any scars on these pictures, maybe a tiny bit, but that's it. Third picture?
Well, the scars are hidden. There's one up in the armpit.
Oh, really?
Usually it's really hard to see, and that's where I do most of the liposuction.
Okay.
And there's one along the inferior portion of that areola, that pigmented skin. And because the skin is darker, it kind of hides.
Yeah, that's
so
really
the
nice.
scar, if it's
and
dark,
the hair
hides in the areola.
helps hide it?
Yeah, we got that too. So this is puffy nipple. So he has kind of small puffy nipples. Problem with that is any sort of tight shirt will show that fullness.
Yes, and that would hurt.
Yes.
Probably just if you're not wearing.
These tend to be more sore. In this case, this sometimes I can do under local if it's a small area like this. Just make that little incision around the areola. It doesn't require liposuction.
Right.
So you just remove that glandular tissue and it smooths right out.
So that's all you had to do.
Yep.
And recovery time on these? Next picture.
Recovery is like doing a bunch of push-ups. So it's sore, muscle ache soreness. Usually 3-4 days, people are feeling pretty good. So if they're used to working out, they're used to that
sort of pain. You can go to work quickly the next day?
Pretty quickly, yeah. I limit some of the heavy lifting, though, just so we don't get extra swelling.
Gotcha.
Or any fluid in there.
Sorry, honey, I cannot hold the baby today.
There you go.
All right, next picture.
This is a bigger puffy nipple.
Yes.
And this is the side view, so you can see it. Just a lot of glandular tissue there, and I think in this case I did do a combination of lipo with reduction.
Okay.
Again, the areola itself was not reduced, so there's no scar running all the way around the areola. It's just underneath that 4 to 8 position, and by removing the stuffing, it kind of shrinks back on its own.
And final picture. And can men also do they ever get implants under here to make them look like they have a bigger chest?
I'm just not a fan
stronger
of pectoral
chest?
implants. They just don't look right on most people.
Agree.
And as soon as you start to flex or move, they don't behave like a normal muscle. So I just don't do them.
I don't see a lot of men coming in for them.
Yeah. No, we don't use a lot of implants in men.
All right, final picture?
Final picture is more just like diffusely large. This is someone who, if it doesn't have glandular tissue, would do okay with just liposuction.
Yeah, okay, so no fat pad on that one, just lipo.
Yeah, so in these cases, sometimes we just do lipo with them. I don't need to make the incision around the areola at all.
And can this be done if somebody has the gastric bypass and they lose a lot of weight? Do they come in for gynecomastia?
They do, but it's a different operation only because with massive weight loss, there's also the extra skin to contend with. So in those cases, usually just unstuffing it is not enough. Usually the skin's already folding over. So we may make an incision underneath the pectoralis, the fold under the breast, in order to get rid of extra skin.
All right, sounds good. We're out of time.
Oh.
For more information about Dr. Mealy, you can call him 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. Go to those websites. If you want to send an email question to Dr. Mealy, maybe we're going to see your email on the air, so just go to those websites and hit the contact button. We'll be right back. We have one more segment. It goes so fast.
So fast.
Keep it right here on Body Beautiful.